Good evening and welcome to Louisiana Public Square. I'm Beth Courtney.
And I'm Craig Freeman. Tonight, we explore the state of Louisiana's healthcare.
We're focusing on how Louisiana's health problems parallel those of other countries, particularly the plight of children. Media reports and documentaries such as the recent PBS series RX for Survival have talked about the healthcare challenges of developing nations. These global issues are disturbingly similar to those facing Louisiana.
Also, some healthcare reformers are trying to remake American medicine to improve patient outcomes. They hope to rethink the way both patients and physicians approach healthcare in America.
Whether at home or abroad, the need for good healthcare has never been greater. Infectious diseases like tuberculosis were once on the verge of being vanquished. Now they are making a comeback, and newer diseases such as West Nile virus, SARS, and the avian flu threaten us all, no matter where we live.
We now live in what has been described as a global village. What goes on in one part of the world could easily end up in another part of the world.
In a time when millions of people jet across oceans and continents every year, disease-bearing microbes have no borders. This situation should be cause for concern, according to emergency room pediatrician Joseph Awatwi.
Someone may be incubating an illness, will jump on a plane and fly here. And whilst here, the disease becomes full-blown. Those who've been exposed on the plane, in this state, are all at risk. So yes, we need to be concerned about what is going on in other parts of the world.
Unfortunately, children often bear the brunt of the world's health problems. Nearly 10 million die each year. 90% are under 5 years old. As told in the recent PBS series RX for Survival, newborn conditions, pneumonia, and diarrhea are among the top causes of child deaths, followed by malaria and AIDS. Infant mortality rates in the U.S. are generally lower than in third world nations. But among the states, Louisiana ranks near the bottom in this and many other health categories. David Hood, former head of the Louisiana Department of Health and Hospitals and now a PAR researcher, thinks the U.S. has better health care than developing countries, but
in terms of health outcomes, in some cases, third world countries may be better off than we are. They tend to focus on primary care, for example, primary and preventive care. And I think that as far as that comparison goes, we fall way short.
This worries Dr. Joan Whitkin, Director of Maternity and Child Health for Louisiana's Office of Public Health.
Louisiana ranks 49th in our infant mortality, and we have a long road ahead of us to address that. However, on the health care side, we rank 8th for getting women in early for prenatal care and having the right number of visits. So there's a disconnect. So that disconnect comes in prevention, comes in education.
Dr. Bill Cassidy, Associate Professor of Medicine at the LSU Health Sciences Center, agrees.
We cannot look at health care as occurring in a vacuum. The things that most correlate with people's good health is being well educated and being prosperous. As long as we have a population which is impoverished, we're going to have health problems. As long as we have one that's poorly educated, we're going to have health problems.
While trying to overcome its daunting education and poverty issues, Louisiana is spending $9 billion, a third of the state budget, on health care. At the national level, some health policy experts estimate as much as $400 million are wasted on treatments that don't improve patient health. But relatively inexpensive initiatives, usually involving preventive actions such as immunization and early detection, have resulted in cost savings and positive health outcomes. A problem for many in Louisiana is access.
The system that we've got actually discourages people from going to see the doctor. It is so difficult that they may give up and not try to see a doctor. That delays diagnosis and treatment of serious problems. And when that happens, your chances of being cured, your chances of recovery, all those things are diminished. And we can attribute that in large measure to the fact that we have a hospital-centered system.
Nearly 900,000 citizens rely on Louisiana's system of charity hospitals, in effect leaving them without a primary care physician. Louisiana has the 4th highest rate of emergency room usage in the U.S. For many Louisianians, the doctor's office has been replaced by the ER for every ailment, chronic or acute.
our people are less healthy than any other state in the United States. We vacillate between 49th and 50th in the nation for health of our people. That is sad. And our per capita cost is equal to and higher than most other states.
Health reformers like nurse practitioner Ginger Hunt are trying to remake American medicine by transforming the patient-caregiver relationship, using proactive solutions and employing the latest digital and information technologies. This electronic medical record-keeping system is about to be deployed in the federally qualified health clinic where Hunt is director. She expects this type of innovation will cut costs at her East Feliciana Parish facility and enhance patient care.
Everything with the teleradiology is done here. They go one block for the x-ray. The image is sent back to us and to the radiologist at the same time. It's read, we treat, and it's all done here within an hour.
In an effort to expand health care access in her mostly rural parish, Hunt also opened primary care facilities inside 2 local schools. The clinics are unique in Louisiana because
we treat not only the children who enrolled in school here, but the families, parents, grandparents, teachers, and bus drivers that are associated with the school.
increasing access to health care is just one of many areas needing innovative thinking in Louisiana. Some observers, like Par health expert David Hood, see this moment in time as ripe with potential for change.
The rest of the country is really watching Louisiana here to see what we're going to do with our health care system. Everybody realizes what a shambles it is in now and how dysfunctional it was before the hurricanes. We can either become a model of how to improve the healthcare system. We can be in the forefront of having a good quality, cost-effective, and well-performing healthcare system, or we can show everybody that we're not able to put this house in order and do what needs to be done. It's totally up to us what we do, and I'm hoping that we make the right decisions here.
As usual, our audience tonight was selected at random by LSU's Public Policy Research Lab. 47% of respondents identified themselves as Democrat, 30% as Republican, and 16% as independent or other. On economic issues, 22% are in the liberal camp, 37% are moderate, and 37% are conservative. When it comes to social issues, 32% have liberal leanings, 26% are moderates, and 37% are conservatives. Of those who were originally contacted by phone, 43% were white, 46% were African American, and 6% were other. Nearly 57% agreed with the statement that the U.S. government spends too little on health care programs in the developing world. But when it comes to improving children's health, 60% felt that our first priority should be children living in the U.S. rather than those living in developing countries. There was strong awareness of the dangers of global illness. 75% of the audience disagreed with the statement that diseases in developing countries have little impact on the U.S. On the home front, 47% thought that Louisiana's infant mortality rate was higher than the rest of the country. Sadly, they are correct. So let's start with that. What do we have to do? Why do we have a high infant mortality rate in Louisiana? What do you think? Why are infants dying at a higher rate here than they are anywhere else in the country?
Well, actually, I feel that they're not putting as much emphasis on the infants that are being born as they are infants of other nationalities. It doesn't make sense. They have the money, they have the resources, they have the places, but they're not using them. And that is a big problem that many people here in America simply seem to go over and over again. It doesn't make sense.
Kelly, I saw you nodding your head.
I think one of our biggest problems in Louisiana, and I'm coming in as an outsider from the Midwest, and I have seen so many young women, and I work in a hospital facility for where we have a cross-section of students, is that so many young women give birth so early, yes, having babies at 15, 16, 17, many of them having children and they're still children themselves, and not getting the proper prenatal care, not knowing how to care for themselves or care for their infants, and resulting in many times they have been using drugs, or they have used alcohol or other substances, and the child, the infant, pays for it.
So it's an individual problem, it's the mothers in Louisiana, or is it the healthcare system? Christopher?
Well, I think it's more really to do with your economic status. You know, being able to actually go to a doctor. You know, you have, most people probably have never been to a doctor, you know, or once or twice. So going to the doctor is not a normal thing to them. It's not like when they get sick, go to the doctor. No, they don't think like that. Like a person with, let's say, health insurance might, because, you know that they can go, they can be seen, it won't cost that much. But when you're a person who, you know, a doctor is something you don't really know about, you know, you've never been to a doctor. You know, when you get pregnant, you're not going to be thinking, well, I need to make sure I make my doctor's appointment or this and that, you know. So I think it's more with the people who have the access and the people who don't. And that's all based on economics.
Leslie?
I think it's a nutritional problem, and I also think that they are given medications for certain things, let's say like STDs or something like that, and they are not taking the medication, and the baby suffers for it. And they are, you know, they are where they just don't listen at the doctor as he prescribed medicine for them. They don't eat the right things. They eat all the wrong things. They smoke. They use drugs like my neighbor say over here. You know, they does all the things that's not practical for a person that's pregnant.
Sharon?
I still think it boils down to education, because they should know that somewhere along the line. It's just not economical pressure, because a mother with a sick child will find care for that child. And there's an awful lot of free medical out there. Maybe they don't know how to access it, but I think even older mothers are still uneducated as to childhood diseases and immunizations.
Mona?
The first 3 months of pregnancy are the most critical, and a lot of people would not seek medical attention, or possibly, if it was a very young person, wouldn't even realize they were pregnant. And so they may continue with some of their behaviors and taking drugs, or even taking routine medications that would be harmful. So you need to, that's part of it, is early recognition of a pregnancy, and then making sure they feel comfortable enough to seek care, because that can make a big difference.
So it sounds like it's education, and it's not our resources here in Louisiana. Craig?
I agree with Sharon wholeheartedly. I think education is the #1 key. Statistics shows that an educated parent and a knowledgeable parent are going to complete the correct steps to ensure that they have a successful birth, and in turn have a successful baby that's going to achieve. So I think it all boils down to the education, not necessarily economics, because if there's a way, there's a means that you can get to the end.
But, go ahead. Okay. But where are they going to get that sex education? That has been an issue at every level. How soon do you start? Should it be in the public school? Should it be part of the church-related curriculum? Many schools don't even have a public health nurse anymore. There are just a few things that that should be part of a health class, and a teacher may be going, well, I don't know if I should teach this or not, because I might get in trouble with my school board if I even bring this subject up.
Jump in. Sounds like you guys have some things to say.
Well, I know that in high school right now they are teaching health programs, but it's not necessarily like the kids want to listen, because what they say is real boring to students. And I think the economy really needs to learn how to make it more interesting and more what a student wants to see, instead of just, oh, it's a health class, I don't want to listen, I'm going to sleep through it.
But one thing I want to say, that most of the young girls that are getting pregnant, they are in serious denial. they will believe they are not pregnant more quicker than they would that they are.
Are we saying that our infant mortality rate is solely based on youth and teen pregnancies? I don't know.
That's a question.
I don't know.
I mean, because I'd be interested to see what the statistics are, that if our mortality rate of infants is based on teen pregnancies, then I think that would be a great area to concentrate education. I think it'd be a great area to say that, because I have teenage daughters, but their sex education didn't start when they were teenagers. They started learning sex education early, 8, 9, 10 years old. And so we might be thinking, like you were saying, high school, maybe we need to think down some. Now, I know that I personally would oppose to sex education in elementary schools, but and of course method of delivery and method in which it's taught has always been controversial as well.
But 7th grade is a great age.
Well, see, that's when you pick things up and take it home, because from time of birth, I'd say until that first step, the biggest teacher is the parent. And if the parent isn't trying to teach anything, the kid is gonna go on off and do whatever they want to do. Just like watching TV. When they get tired of watching a certain program, you look up and look for them. They're in the kitchen pulling out all your pots and pans.
Now, I thought that there were real problems with the system, or at least there were some concerns about the system, but it sounds like you guys are talking about education. Are there any systematic problems that we need to worry about when we think about healthcare in Louisiana, when we talk about obesity?
Right now, there is a school nurse available at every school. Some nurses have a school nurse full-time, and some have access to a school nurse on certain days. If there's any kind of major issue, that nurse is called to that school. So their ability to get into certain healthcare issues are much broader than the teacher, because there is, as she said, there are certain guidelines, you can't cross this line. But the nurse, because that is a medical issue or healthcare issue, they can help a whole lot more.
But what about in
and
school
judging from those questions that the nurses are getting and some of the situations, I'm a school nurse. Judging from some of the questions that you get or some of the situations that you recognize, the information is not being presented to them at home.
What about obesity? You talk about messages that you get from home. Our kids, I think 63% of our children are obese. What can we do to solve that?
Basically, what has happened is that the moms have to work and the dads have to work, and some of them are working 2 and 3 jobs at a time if there isn't time on the clock. Well, and the kids are eating from Burger King, they're eating from McDonald's, they're eating from Popeye chicken, they're eating from Church's chicken, and mom and them is tired now, so you still got to eat it because mom is home, but she's not after
They
cooking.
give enough education on that, though.
Parents.
I think.
Go ahead.
I think we as parents, the first thing we need to do is unplug that television, take away that iPod, and encourage our children to go outside and participate in physical activity and to exercise. A lot of times kids come in from school, they drop their book sack down, and the first thing they do is grab a pizza and sit in front of the TV. Also in the school, being a former coach, every time we have budget cuts, the first thing they want to do is cut physical education, take away physical education. So, and that plays a primary role in why we have such high obesity rate in this country.
And obesity is a national issue too. It's not just a Louisiana issue.
But you see families though, and to reiterate on what he's talking about, families though don't spend time together anymore. Everybody's living as individuals, from the baby that's 6 months old to the grandfather who's 77. There's no more, families where families come together and, like you say, parents have to work now. You have so many things where, gas $3. People have to work all the time, so they feeding their kids unhealthy things. Families don't spend time together, and then you give them all these things to just occupy them, so you can do what it is you need to do.
That's right.
Maxine, I saw you back there. Is there anything we can do to help? It seems like these are all individual problems, and these aren't problems that the state can really fix.
Well, those are individual problems, but there are some problems, again, towards the state side and looking also at hospital access and things like that. And when you do have a child that may have difficulties or problems, finding help, assistance, doctors is very difficult. In Louisiana, it seems we have a shortage of doctors, particularly specialists. So if you have a sick child, you may have to go out of state, or you may have to wait a while before those services can be provided. So as a result, I think that also harms the infant, and I think that also adds to the mortality rate.
Are we not the only state, or possibly one of the few, that has a charity hospital system? And also, I think that there is a tremendous amount of resources for children with disabilities. I'm personally familiar with some. It's, again, a matter of education and going out and finding them. There's faith-based organizations, there's the March of Dimes, there's the Shriners, there's muscular dystrophy. It goes on and on.
Louisiana is
services, but again, access to the doctors who are actually going to provide the treatment, that's where sometimes you may fall short.
And Maxine, you talk about doctors. How do we prevent things like infectious disease? How do we prevent things, you know, like the avian flu spreading to Louisiana? Do we need to do more here?
More
Frankie?
Education probably on those particular issues, how to prevent them, and what we as individuals need to do.
The basic thing is education, when you go back to it, and then not waiting until you get into school. When you are in the crib, this is when you start teaching children not to eat, when you pick it, and when it drops on the floor, and just the little things, the little everyday things that you want children to understand. Washing your hands, covering your mouth, and trying not to cough on somebody else. There's so many little things that we could do.
Yes.
And you gotta train them, because if you don't do this, and you gotta be consistent, because once you tell them that you shouldn't do this, and then you do the same thing that you just told them to don't do, then you've defeated your whole purpose.
So maybe the parents need to be educated, right?
Yeah, that's it. The parents need education.
Though, but we can't forget, though, to get this education, there needs to be resources. I keep hearing y'all say education,
Okay, let's have a class.
but economic, you can't forget, they go hand in hand. You can't throw one way without. So you're saying education about obesity, education about infant mortality, but where you gonna get the money to educate these people?
How many strides have been made
Even though
in
there are some
childhood
people
obesity?
who volunteer their time, you have to have the resources to educate people.
Latchkey kids.
It's not
Most of them are. Their parents. Well, I mean,
You can't throw it away. That's right. You can look at an obese parent and look behind, they're going to be an obese child. Following. And it starts with the parents. And healthful eating at home starts with the parents and trickles down to the kids.
Now, Christopher brought up a point. I wanted to make sure we got to this point. Do we need to have a big charity hospital system? Or do we need to have some community-based hospitals so that we can more effectively get to individuals?
Well, Louisiana is the only state with a statewide charity hospital system. But as we can see, though, it's on the breaking point. It's on, it's on the verge of falling apart.
So what other states do?
Well, some states you'll have it where the county in that state will have a charity system, but it's not statewide. You see what I'm saying? Right. And this is here, but we've since this storm happened, Hurricane Katrina, we've seen that our charity system has a lot of flaws that needs to be worked on. But I think it's a good idea because it has helped a lot of people.
I'm a parent who has children on the Louisiana CHIP program, and I have they've been on that for some time, and I've run through different situations with broken bones to neurological issues and things of that nature. And it is frustrating to, for example, we had to sacrifice in dental care through Louisiana CHIP program and losing good teeth based on who were the dentists that were chosen to be the providers for that. And fortunately for me, I found a good switch, but making a switch was an issue. Also, they've seen, for example, one of my children have broken their bones a couple different times, and I've only had one provider for broken bones available to me. And so, it's one thing I could go to a close by hospital for an emergency situation, but I still have to get funneled back to long-term care under another physician. And personal physicians do not take Louisiana CHIP. So I'm limited. We're single income family. I'm limited to even who my options are as far as choices. And then to be in a situation where I'm not educated about health care, or I don't have the know-how to think of what other options might be. These young mothers that we were talking about, they're not even educated enough to know that they can be thinking through some other options. But it's been frustrated for me, and I'm an educated person.
Joanne?
I think, if potential childbearers, be they man or woman, if they would learn to love their offsprings, even the animals, before they produce a baby, they provide a nest or a den or something. But the majority of the humans, we do not love our offspring. And when we don't even have enough income to provide our own needs, we go and invite our own children into this world.
But sometimes we talk about love and loving our offsprings, but if you're not taught, then you can't teach.
That's right.
And that's, I think, a lot of the problem is that a lot of people are not taught. And the ones that come behind them or their offsprings, they're not being taught. It's not being handed down. Okay, and we talk about educating, and it's good. And I really believe that we should educate. And there are a lot of resources out there. I have two daughters.
And Melinda, I don't mean to cut you off, but we're running out of time for this part. We're going to get some experts in a couple of seconds to help us answer some of these questions. And so when we return, we're going to get a chance to talk to our experts about some of these issues on Louisiana Public Square. We're discussing healthcare tonight on Louisiana Public Square. Joining us now is our panel of experts. Elizabeth Fontham, Dean of the School of Public Health, LSU Health Sciences Center in New Orleans. Dr. Fred Cerise, Head of the Louisiana Department of Health and Hospitals. Dr. Dawn Sokol, Infectious Disease Specialist with Ochsner Medical Center, and Melinda Sothern, Ph.D., Director of the Pediatric Obesity Clinical Research Section, LSU Health Sciences Center in New Orleans. Let's go to our participants for their questions. Mona, you are our medical expert. What question, as a nurse, what questions do you have for our experts about how we can improve healthcare in Louisiana?
Well, actually, I sincerely hope that the group that I'm with, healthcare centers and schools, we have school nurses in all of our schools, and we found that early intervention is a key element here. Where everybody keeps talking about education, so we're thinking we're teaching the kids to be healthier, who will go home and help their families get healthier, and then we'll be a healthier community. And so we have many projects that we're working on and feel that we've already made an impact and hope to make even more of an impact.
Experts, is education the key, or is there something else that we're missing?
Well, there's a lot of talk about education. I think you're all making very good points. If you look at the things that cause disease and death in the U.S., so much of that is related to behavior and habits that people develop. And so if you look at the major contributors to death, Terry, you can jump in here. It's obesity and it's tobacco. Those two things cause greatly outpace other determinants of disease in the country. And so if you can start developing good habits at an early age, not just in school, but certainly at home as well, and those develop the right eating habits and exercise habits and the right attitudes about smoking, those are going to have huge impacts and payoffs down the road.
Many of those habits start in childhood, as Dr. Cerise clearly made. And your point about the relationship between children in school and the families, it's a package. If we want to change children's eating habits, we can do the right things at school, but the parents have to be a part of the process too, or they go home at night and eat the wrong things. So in answer to your question, education is important, but education in a vacuum is probably not enough. We can be told many, many times that seat belts are really important for saving lives in automobile accidents, but until we passed a law making it mandatory, not everybody used them. Putting children in the back seat, in car seats, making that mandatory. So education is critically important, but sometimes regulation comes in there too in terms of public health.
So when you're talking about prevention, I'm listening to everyone talk, it would seem that the best answer would be prevention, to any disease, anything that we're facing medically. But the thing is, maybe the panel can comment on this. When you have, you have certain generations where, some parents like sex during, like, let's say the 50s and 60s was a taboo subject. That's something you didn't bring up at home. And then it passed on to them. And then they passed, now we have, even though now you have it to where parents and children seem to act more like friends than parents and children, and they'll let more things be, open to children, but we still have it where, there's plenty of people out there that just don't even know basic things about sex. How can you be preventive when you have parents who can't, because everything really starts at home.
I have a question I'd like to ask you. What would you say a CSD would be?
A CSD?
Yeah. It's pretty simple.
Don't know what that term means.
Well, see, you and a lot of other people, but I'll go ahead and go and put it out on the table. It's just simple, common sense degree. If you see fire, are you gonna touch it? You may catch someone that is gonna put their hands on it, or especially a baby, because the mother's sitting there or the father's sitting there, they got the fire burning, but they're not telling anything to the child. And the child's gonna wanna see, why is it blue? Why is it yellow? Why is it orange?
And I think what you're saying, is there anything we can do to help parents and citizens learn more about these problems early to prevent these issues?
Well, there are cultural beliefs that are hard for the barrier to be broken, and yet they need to be, and there's educational objectives that need to be done to help get around those. And sex is a big taboo area. It is.
And it's amazing, though, because one of the simplest things parents can do to combat a lot of these diseases is to control the television.
That's right.
And all of you know about this, but
All the movies.
right?
You can't do that.
Yeah, the obesity problem. There's a high relationship between TV watching and obesity in children.
Yeah.
And also that's related to the other disease we're talking about, cancer and diabetes. No one's even said anything about that, but that's growing in epidemic proportions. But it's not very easy for parents to give up the TV because sometimes the TV is the babysitter, and that's what I heard you earlier. So I think the parents need parenting skills, and we do need programs that will provide these for parents, especially the younger parents. So that is a definite need, and you were right on target there.
Yeah. I mean, schools give driving classes, they give classes maybe in home ec or cooking, but where do they ever get taught what's the right way to be a parent? And their parent may have been a bad example, and yet parenting classes are not really offered.
Same as by putting more condoms out there is not the answer. It's not. The teaching and the education of the whole thing is what you need to do. Because condoms, you can put them out there, but nothing is foolproof.
You always have to accompany changes in behavior and changes in environment with education, and that's clear. So yeah, that's a good point.
And then plus too, you have to provide other activities for young people. I'm one of the older teachers from back there when they didn't have PE in the schools for girls at all. They didn't have anything for girls. And my argument was that we need to put something in there for them, because the only thing that they can do, you see, the boys can say, okay, well, basketball, and I'm super here. But what do the girls have other than the only thing they can admire is, oh, well, I got to win this guy, so I got to do this and whatever he says, and one's trying to compete with the other to win his attention, and therefore you get your pregnancies. So you have to substitute these things that television is selling every day for something else, outdoor activities.
After-school programs are actually shown to reduce obesity in girls. If there's just, in dance classes, for example, have recently been shown, just these fun dance classes can actually reduce obesity in girls, so why don't we have these programs?
Well, they also increase self-esteem.
Yes,
and
that's
self-esteem is a huge factor in the teenage years in particular. It's a pretty big factor in all of life, but having good self-esteem is going to have an impact on decision making, whether to engage in early premarital sex or not, and many other risk behaviors.
Substance use of, controlled substances, alcohol, those sorts of things.
And exercise actually improves the same mood chemicals as do all these agents that they want to take. So if they actually would engage in exercise on a regular basis, they would feel better, and they wouldn't need to go to drugs, alcohol, cigarettes.
And there's something else too that
I was going to say, Sharon, I knew you had a question.
I think we're just not giving credit where credit's due to a certain extent. So let's just say a little bit good that's happened. And I think that advertising has come a long way and made huge strides just in the past, say, 3 years on childhood obesity, on diabetes, on and programs like CHIPS. And you know, it takes a while. It doesn't happen overnight. Now, you will hear people that'll say, what am I going to do? My child has no insurance. Oh, I read this in the newspaper, try like CHIPS. And drugs, there's commercials about drugs. There's all kinds of publications. They're available in the churches and in the schools. So I think that they have come a long way. You'll see people in the grocery stores actually reading labels now to get the caloric content and nutritional value. So it's just going to take a while. We'll just keep it up.
And when you talk about CHIPS, we talked a little bit about some of the problems with the program. Are there any issues that you're concerned about?
Well, I was saying earlier about my children are on Louisiana CHIP, and one of the problems I had was with a broken bone. I only had one bone doctor that we could go to after we came out of the emergency center. I had only one dental care provider that was available to me. And one of the things that in my probing and questions is that the physicians are not wanting to deal with Medicaid in that nature because they don't. For example, the dentist said she only gets $10 to clean a mouth. And I said, well, I think you've cleaned $10 worth. And unfortunately, the rest of them cost them the price of their teeth because she just did the very minimum that she could do. So my frustration in being someone very concerned about my children's health has been based on what's eligible to us to be qualified for Louisiana CHIP, the frustration in just trying to get good care within that system that's provided for us. Now, I don't know about someone else that's outside of that system. I personally do not have personal medical insurance. My husband does. I haven't seen a physician in 10 years. If someone would ask me who my doctor was, I couldn't tell you. I'd give you a name.
And Dr. Cerise, what can we do?
I mean, there's a few things to address in your question or your points. One, from the dental perspective, you know, we do things in Louisiana that just don't make sense. We will push coverage and do things on the treatment side when we haven't done all the requisite work on the prevention side. And so we've got large communities, Baton Rouge, for instance, that doesn't fluoridate its water, which we know is related to better dental health. Yet, you know, we will end up paying for it on the back end when we've got to address issues of inadequate rates for dental services in the CHIP program. And so, again, there's some things that make a lot of sense that we need to do on the prevention side, and we are trying to push on those issues more, but you would be surprised at the number of big communities in this state that don't do basic things like fluoridating the water. The CHIP program has come a long way. If you look in Louisiana at the uninsured rate, we have a high uninsured rate in the state. If you look at children, the uninsured rate is relatively low compared to other states. Only about 7% of the kids in the state are uninsured, and that's because of the CHIP program. Now, the challenge, and one of the challenges of the CHIP program, is how to become more competitive with the rates that program pays, and that's an ongoing struggle for the state. And your story is not unique. Limited supply of specialists, particularly in some areas, and I think we need to do a better job of trying to do things to better engage those specialists into the programs. Rates is one piece of that, but there are other things that we need to do as well.
Not only was the amount that they felt like they were reimbursed inadequate, they didn't want all the red tape and everything that was involved in it. I have one of my children that needs to see a neurologist but can't because he's in New Orleans, can't do that because since Katrina, they're not able to be seen. And so I have one neurologist available to me in New Orleans from Baton Rouge. So just things that I'm a pursuing parent. But if I was one of these teen pregnancy children that we've talked about earlier, or someone maybe that would not be as educated, or I don't want to imply I'm real educated, but not as persistent, would shrink back. And then that in itself creates this cycle of the repeat of issues in poor health care continued in our state.
One of the things that I'm very concerned with, I work in a mental health facility, and since Katrina, we have, I think, Katrina uncovered a lot of things wrong with all health care, but particularly in mental health. And as I was coming in tonight, I was listening to NPR, and the number of Louisiana's kids who are living out of state and in other places in this state from the New Orleans area who are undergoing crisis in mental health, and there is nothing to help them. And I work in a facility where we're way out in the country. Maxine and I used to work together. I'm the teacher, and we're way out there in the country. It's hard to get the kids to the facility where the help is. We have to bus them in for that help. And I see a crisis in mental health care for adolescents.
And Kelly, you bring up a good point. Are we concerned about having to get kids to one big facility? Do we need to have smaller facilities? Is there any change in the system that we can make to make this better?
It's good to build those facilities, but we need the qualified doctors to go in them.
Dr. Cerise, what do you think?
Well, I think a couple of points. One, the mental health issues are real, as you've stated, and one of the things that we've come to realize is with the system being disrupted the way it has been in Orleans, even if you have funding, as we have been able to acquire through the federal government to bring some assistance to bear, we don't have ready access to the number of providers that we need to deploy, particularly in the Orleans area where we've got serious housing issues. To be able to deploy enough resources in there to meet the needs is an ongoing challenge. In terms of deploying or putting the resources out and devolving from sort of the centralized system of care, I think everyone recognizes that's a better model if you can have care closer to where individuals live. Now, that's not to say that these sort of large medical centers don't make sense when you have a sort of a collection of expertise and specialists and diagnostics and those types of things. But for the basic care, the primary care and the preventive care, to have that more accessible in communities where people live, that makes a lot of sense.
Are the kids in Louisiana getting care that's better than children in third world countries? Yes. It's not even a question. And tell me more. I mean, Dr. Sokol.
I feel we are.
They're definitely, that even though there's access issues, they're not anywhere near as great as of access. The nutrition issues aren't there. The availability of technical and medical and just all across the board, it's not there, but it's still, we have room for improvement. There's an inequity. I mean, that was brought up by Gwen. And yet, depending on the city you're in or the rural versus the larger city, providers, some people saying yes to this and no to that. There's differences that we'd like to see not exist.
It was about a year ago that they had some forms that you were supposed to fill out to have your primary care doctor.
For a child?
For a child, I guess most anybody, and for to say you're supposed to have a particular doctor that you see, well, why do you get one changed on you all the time?
I believe you can request a change you can request a change. You can change that again.
No, I'm saying that they're not requesting to change themselves. Like they go and see Dr. Brown, and then when you know anything, they see Dr. Brown a couple of times, and then now they're seeing Dr. Bill. It's just always a change in the doctors, and everybody have their own idea as to how to treat you. What was working for you, and you felt great, then somebody come along there and they change a little something, and it's not the same, and you go back to feeling a little bit different.
Well, I've had the same patients for 15 years, and a lot of them are Medicaid patients, and I won't give them up, so I don't know why.
You got some good patients. You got some
That's
good
beautiful.
patients.
I know they love you. They really love you.
Just last week, I was trying to get a dental appointment, and I looked on the provider sheet, and I called this dentist to say, "Oh, they still have me on there." No. I told them to take me off the list. I said, "Well, why?" He said, "Well, it takes too long for them to pay us." So you see, that's it. So I gotta find
passion from the doctor. You can't blame that on necessarily the economy because each doctor is different. And if you have a passion to like help somebody, then you can't take that in each person because each person has different wants and wishes. Some people are in it for money. Some people are actually in it to help.
Yeah, well, I can understand
Some people are
that.
dedicated.
But in
I see what you're
actuality, you
saying.
have to look at the fact and of the matter of how people assess themselves. You know, because it's just like going to work, getting paid every 2 weeks, and then you have that 1 week that you don't get paid, but the next week you get 2 checks. And a lot of people don't realize it like that. If the simplest of them would just realize that we're not in a system of stocks and bonds, so to speak. We're more or less in a Crayola world. Because everyone has their specific color. And if you think about it, there are some colors that people put together to get another color. So, you don't have to worry about anything else. All we have to do, we have the resources, we have the availability. We can actually, from Washington, the president can tell his people, look, just send everybody $100. We making it, so it's no problem.
What about a mobile? My church has just started a mobile unit, a mobile medical unit out of the needs that generated for Katrina. What is something like that? Maybe funneling some of the monies that are not being embraced by some medical care physicians. What about it being concentrated in some traveling vehicles that could go into some of these areas to have set days, say, for these care and shots. My daughter has decided to become a nurse from her experience in working at Lamar Dixon after Katrina, and then having nurses and that availability of seeing the need for that. That, which brings up another thing I'd like to say, is we're not generating an interest in the medical field as well within our state. We were talking about educating, and I was thinking, how are we promoting careers to be taken up in our state?
We have a school of public health, right, Dr. Fontham? We should tell them about that. But you're right, though, you said shots. Vaccines are free. They're free regardless of your ability to pay. Any child can be vaccinated, whether you have Medicaid or not, free. And yet we do not have a fully vaccinated population. So, there's complete access to vaccines.
Did y'all know that?
Did you know that
Complete.
And it's one of the issues, I think, what you're hearing.
Any health unit will vaccinate you. You walk in and present yourself.
Down so they can say that they're saving some, or taking one case, making 2 cases out of it, so they're saving some, so they don't have to pay out as much, so they can pay their workers as much. A lot of people don't realize that, and that is
Dean Fontham, tell us
something
more.
that can be done.
And what else? Are there other resources that people don't know about that we can get more access to? I didn't know that kids could get these vaccines. Yeah. We've got the school here. What else are we missing? Is there anything else that we need to know?
I would say there are a couple of resources. We've talked a lot about dentists and access to care. One of the good things that came out of Hurricane Katrina is, although the dean of the dental school might not agree to call it a good thing, but in fact, the LSU Dental School, which is in New Orleans, was completely inundated, and they developed a whole new school of dentistry here in a wonderful facility. They're about to get 30 or 40 more chairs, and when they go back to New Orleans, which they most certainly will do, they intend to maintain that dental school presence here in Baton Rouge. That's a wonderful resource because their students need to learn, and regardless of the ability to pay, people can go. So I'd encourage you to definitely look into that.
It's a long waiting list usually.
Christopher.
But I want to ask the experts though, with the type of healthcare system we have here in the United States, we have private industry in healthcare, government, everybody got their hands in it. It's money. People are making money. We live in a society where, as far as the United States, we're teaching people how to live with things instead of trying to cure these things, especially with, prescription medicine, but I'm not gonna get into all that. But with, like Canada, where you have a system that's universal, I believe England is, and France as well. How is it though that we can make these changes when, even with all the resources, all the programs for people, we're living in something where healthcare is not free to everybody. It's not. I cannot see a doctor. I'm a single male. There's no program for single males far as free healthcare. And then you have a universal, and how can you expect things to change when you have this type of system set in place? And we want to change things for children, and then in the world, I just don't see it happening with this type of system we're working with. I mean, what?
And is the goal universal health care? Is the goal to help kids? What should be the goal for the state system, at least?
Well, I think, what you're hearing is we've got an incredibly complex system. You've got employer-sponsored insurance, you've got Medicare, Medicaid, you've got a system for the uninsured, you've got a VA system, you've got, and within each one of those, it can be incredibly complicated to negotiate as well. And I think as a society, we've already decided that everybody will have access to care. It may not be in the way that we think is the most efficient or most effective way, but if you show up in an emergency department, somebody's going to take care of you. And so it makes more sense for us to put systems in place to provide that treatment on the front end and not have to have a default emergency room system of care.
And Dr. Cerise, you're going to have to be the last word, at least for now. We want to thank our panelists, Dean Fontham, Dr. Cerise, Sokol, and Sothern. When we come back, we'll have a few closing comments.
Louisiana, the state we're in. The statewide news magazine that brings you the story behind the headlines. Now in its 29th season, you'll discover how the people and Louisiana will recover from the devastation of this year's hurricane season. You'll hear how it will change the face of politics and how it affects your life. Louisiana, the state we're in, also highlights the culture, arts, and characters that make our state unique.
That's all the time we have for this edition of Louisiana Public Square. We invite you to take our full online survey about the issues we discussed this evening by going to lpb.org. And a complicated topic tonight, Craig.
It really was. It really was. We could probably have a whole series just on healthcare. It's always such a pressing issue. But next month, Louisiana Public Square will host a forum with the Governor Blanco, and members of the Louisiana Recovery Authority on the latest guidelines and requirements for rebuilding housing in South Louisiana. Thanks for watching, and good night.
Good night.
A home video of this program is available. For more information, call 1-800-973-7246 or write to the address on your screen.